and welcome to Ask the Doctor. My name is Jerry McGee and I'll be your host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time. On today's episode, we want to talk about the problem of sciatica. We've had a lot of people asking about, what are some causes, what are some symptoms that they might have now, what can chiropractic do to help that? So if we could start off with, could you give our viewers just kind of an overview of what is sciatica and what might be some of the root causes of that?
Sciatica, Jerry, involves the sciatic nerve. It's the largest nerve in the body. It's formed by the last three lumbar vertebrae, L3, L4, L5. It goes right into the glutes, down the leg, the hamstrings. It bifurcates. Part of it goes in the front of the leg and in the back, into the calves, and it goes into your feet. It's a very, very painful condition. It can cause like what is called sciatic paresthesias, where they get pins and needles and numbness, burning. Okay, it's a very, very painful condition. I've never had it myself, but I've talked to our patients who've had it. It's very, very painful. What you do, Jerry, is you find the underlying root cause of the problem through a chiropractic exam, orthopedic, neurological. You find exactly the root cause of the pain, which is usually a pinched nerve, which is L3, L4, and L5. Think of it as a hard bone out of position pressing on a soft nerve. The soft nerve goes into the leg, and that's the sciatic. Also, a lot of times, in a lot of cases, it's from a disc. Okay, the disc is protruding, it's pressing on the sciatic nerve, and 9 times out of 10, 99 times out of 100, we can actually fix it through chiropractic care.
Okay, and one of the, as I was kind of, online doing a little research on this, getting ready for this, one of the things that I saw that was kind of interesting, maybe some guys could relate to this, they talked about even things with your wallet being in your, and I thought that, the viewers might be interested in kind of, seeing a lot of these little things that can flare up. Have you seen that?
Yes, because we call that an ischial lift. See, if you put something in your wallet, you sit on your ischial tuberosities. I don't mean to get technical with you. Okay. So if you're sitting on your ischial tuberosities and you have a wallet there, what you're doing is you're causing an ischial lift. So you're sitting like this. And if you sit like that 8 hours every day downtown Pittsburgh, don't you think that would have an effect on your hips and your low back and your spine? Mm-hmm. And if you remove the wallet, that in itself is a type of a correction. Mm-hmm. If that works, great. Mm-hmm. If it doesn't, give me a call, and we can see what else is shaking.
So maybe even from a, I know later we're going to be talking a little bit about some work-related injuries and all, but really even looking at a person, like basically what their activities are all day. Maybe they've got a repetitive activity.
Standing even, if you're standing all day. Sometimes standing all day, what's having gravity, it's axial compression forces. So if you're standing all day, boom, right into the low back L5S1 disc. Most discs are L5S1 because that takes the brunt of all the axial compression forces, which affects your disc. So if the disc is compressed, that affects the nerve. The nerve is the L5S1 nerve, goes into your cheek, sciatica.
Mm-hmm. Now, when a client was to come in here, what could they expect? In the beginning, maybe from an evaluation technique, what type of tools, what could they expect at first?
The evaluation, of course, is orthopedic, neurological, chiropractic exam, range of motion, determining exactly what type of treatment they're going to need, how long it's going to take, what kind of results you can expect. I've been doing this close to 30 years. We get excellent results, high 90% of results, because we're getting to the underlying root cause of your problem. If you have a pain, pins and needles, numbness or burning in your low back, lower extremity, it's a pinched nerve. Okay, it's something simple, Jared. You give a specific chiropractic adjustment. We do different techniques. We use SOT blocks. We use a segmental drop. We do the impulse instrument adjustment, which is a high-tech instrument, which is actually 100 times faster than the human hand. Okay, you can do this on 89-year-old women. I have an 89-year-old woman in my office yesterday with sciatica. We're helping her. Mm-hmm. Okay.
Now, I think one of the other important things, as I was looking at this also, is that when these symptoms start, maybe they're just kind of like that naggy kind, that's when you really need to get started, not waiting till you really have irritated that nerve.
Because like if you have a problem, if you have a cavity, you don't wait for it to root canal, you want to nip it in the bud. Mm-hmm. See, to me, Jerry, that's a no-brainer.
Yeah. But most of these, people, unfortunately, the system is, I've got this nagging pain, I think I'm going to take some pills.
Okay, that's like having a red light on your dashboard. Are you going to ignore the red light, or are you going to pull into the Exxon station and look under the hood? What are you going to do?
Right. And that's, as we've done a lot of these shows down here with you, one of the things that we really want people to understand is that chiropractic care truly is a different form of treatment and evaluation than they've seen before from the standard medical professionals.
Alternative care is becoming real big. Chiropractic, homeopathy, naturopathy, Ayurvedic medicine, Chinese medicine, it's all considered a different approach than drugs and surgery.
Right.
So to me, it's better to do a conservative approach first without side effects. If that doesn't work, then do the drugs and surgery. That's my opinion.
Yeah. And one of the things that I want people to understand about coming here to Wellness Associates also is that, you know, your opinion of the whole kind of teamwork approach to a problem.
Yeah.
You know, you're not opposed to saying, okay, listen, we've tried these treatments. Maybe you do need to
Yeah, get an MRI.
go to that
Yeah.
next, right, to
Definitely.
that next level.
Yeah, if this conservative's not working, get the MRI and see how bad it is. Maybe you're that 1% that actually needs surgery. I had a woman here yesterday, her husband just had surgery yesterday. It's his 5th surgery. He's never had chiropractic, okay? Because he has 5 surgery, and the surgeon said yesterday the reason it took so long to do the surgery is because of all the scar tissue from the 4 previous surgery.
Right.
So I never want to get like that.
Right.
I'm going to exhaust my chiropractic options first before I get surgery. That's my opinion.
Right, right. Yeah, I think that, you know, too many times people are quick to go to that end phase, you
Yeah.
know, of getting the surgery where, you know, maybe it's not as immediate, you know, might take a little time, but anytime you can avoid surgery is a good, you know, is a positive thing. Your body really doesn't need to
You said
have
the
all
key
these
word. You
surgeries.
said it takes time. See, that's why we call patience patience, because in order to be a patient, you have to be patient. So if you're impatient, then, you know, you're not going to get the results. You're going to go in for the knife, and then you're going to have scar tissue from that, and then you're going to need another surgery for the scar tissue from the first surgery, et cetera, which had happened yesterday to my patient's husband.
Yeah. Yeah, it really turns out to be a vicious cycle
Yeah,
that never, and that's why you see a lot of people seriously laid up
yeah.
from, you know, from these problems
Which is
and the
needless.
treatments.
Which,
Right,
in my
right.
opinion, you're laid up needlessly. I mean, your body's your livelihood. So
Yeah.
no body, no work, no money, no food, no eat, no live. Basically, what you're doing, Jerry, we're all making life and death decisions every day. Our choices.
Yeah.
Okay.
And one of the things that I want to stress personally to people watching this video also is if you're out under the care of your medical doctor right now, okay, do not be afraid to take charge of your own health. Make that move no matter what. If that doctor says, oh, I wouldn't go to a chiropractor for that problem, they won't be able to help you. You don't need to just take any one person's word on your health.
That's right. It's
Right?
their opinion.
Right. It is up to you to kind of, you know, take that active role and say, listen, I'm going to exhaust every option and see where, you know, what's best for me.
You've heard of this, Jerry. You've heard of second opinion. Okay, there's nothing wrong with the second opinion. Now, see, what we do differently is we give you a conservative second opinion. We're going to give you the second opinion, but we're going to do chiropractically, physical therapy, exercise, nutrition. That's maybe a little bit different than, let's say, getting drugs and surgery. So we're giving you a second opinion, but it's a conservative second opinion. You see the difference?
Right, right, right. I think that's, you know, from today, from a health standpoint, we just really want to stress that everybody should take this active role, get every possible opinion you can for that problem, get started early. You know, when your body's giving you those little aches and pains, that is a warning light.
Right.
Don't ignore it. Come in, might be, you know, a very simple thing that can be corrected with a simple adjustment.
It's simple.
And, you know, it doesn't always have to be you know, a major problem. So, you know, we hope you found this to kind of be, you know, educational in regards to the problem of sciatica. It's a common problem out there.
Yes.
Very common. A lot of people have it. Probably don't even know they have it right now. But if you're having that aches and pains and that numbness and tingling down into your leg, you know, pick up the phone, call Wellness Associates. Come down. You know, Dr. Goldberg offers a new patient free evaluation. So you have nothing to lose. Come down, meet Dr. Goldberg, let him show you firsthand what he can do, what's available here at Wellness Associates. They've got a wide you know, array of different treatment services that are available here, and it's all really under one roof. And so we just encourage you to pick up the phone, continue to watch these videos, and if you have any questions about any specific healthcare problems that you might be having, feel free to visit our website at AskDrGoldberg.com. Click on the email, you know, the contact button there. You can type in your question. We'd be happy to address it on one of our future episodes. So with that, thank you very much for watching this video, and be sure to you know, check back periodically for upcoming videos on different things from work-related injuries to auto accident injuries. A lot of great topics coming up here this month. So thank you very much for watching, and we will see you on the next video.